Hello, welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Matt Mollenhauer, Chief Clinical Officer at Chestnut Health Systems, where he's been for the past 33 years, Matt.
That's a long time, isn't it, Charles?
It all depends on your perspective, Matt.
The only place I've worked post-graduate school.
That's amazing. You know, what's also interesting is that the interview before this I had on the podcast, your longtime colleague, my longtime colleague, Dave Sherrar, who, as of this podcast, has been with Chestnut for 36 years.
Yep.
And I did ask him, and perhaps I should ask you right out of the gate now that you mention it. I asked him, are there any, I didn't mean to throw him a curveball so early in the conversation, don't mean to throw you a curveball so early in the conversation, but he handled it very well. I have every expectation you'll do equally as well, Matt. But I asked him, and I'm asking you, are there any downsides for being with an organization for that long a time?
That is a little bit of a curveball. I think there is the temptation to only look at what we do through Chestnut's lens. And so there's the longer I'm here, the more effort it takes, I think, to pay attention to what other agencies do, what the field does, what's up and coming. And so I think that would probably be the downside. I think maybe.
But it sounds like you've been aware of that.
Yeah, I mean, self-awareness is a part of it, right? But so what do you gravitate to, Charles? So I don't wake up in the morning and go, I'm going to gravitate to all the things I don't know about. I'm going to gravitate to where I feel safe and comfortable. And that doesn't necessarily always mean creativity. So there's a little bit of a willpower component to the idea of making sure that I'm open-minded to what's coming in the field versus the Chestnut way, for lack of a better term.
Is there any, I hate to put you on the spot, we didn't really prepare for this portion of the podcast. Is there anything that's come to mind where it's like, oh, gee, I need to think a little bit differently? The approach that I typically take might not work in this particular instance.
Yeah, the example that has, I think, come up recently in doing some reading is, in the substance abuse treatment space, Chestnut's history would have been about all promotion of abstinence, right? That if you're not abstinent, you're not working on a recovery model. Most of the research nowadays suggests that you can do symptom reduction or whatever term you want to label it as, but that there can be clinical improvement in satisfaction, happiness, depression, job, et cetera, with decreased use as opposed to straight abstinence. And so learning about that and then trying to figure out how to adapt, our treatment approach probably would be the example that runs to mind for me right now.
Yeah, and by the way, we recently did a piece on that very topic, and it was really around the theme of not wanting, or because we long made, what's the expression, the enemy of the good. I think that's the way it goes. And yes, these half measures, you don't have to be 100%. You don't have to get all the way there for there to be improvement. Often when you have such a high bar, it tends to be counterproductive, or it can be counterproductive.
Yeah, and we learned a long time ago when we did a lot more adolescent treatment than we do now. Big wins in the adolescent side of things were attendance at school, less family disruption, less run-ins with the law. It wasn't always the outcome being, abstinence, but if all of a sudden you got a young man or a young woman going to school more, that, hey, who would not define that as a win, right? So.
Right. It all begins with that first step.
Yep.
So Chief Clinical Officer, what exactly is a Chief Clinical Officer, aka a CCO? What do you do on a daily basis? And perhaps if you would give our listeners a sense of the scope of clinical programs within your purview.
Yeah, and I think the answer to all of your sub pieces of the question really tie it together, right? So Chestnut is an agency that runs everything from 24-hour crisis, community-based services to housing, to behavioral health and substance abuse care, and all the way up into primary care and dental via our federally qualified health center. And as chief clinical officer, I actually have responsibility for all of that in all of Chestnut's geographies. So in any given moment in time, a meeting can be about how we do outpatient behavioral health services. It can be about how we move psychiatry into a more medical model. It can be about how we privilege and credential physicians. So it really is, back years ago, we think about care as here's substance abuse treatment, here's mental health treatment, here's primary care. Chestnut is integrated across all of that. So we really take an approach where patients, they don't have to figure out what door to walk in. We'll do that for them. But that means that all staff in all areas are aware of and can support care across all the different avenues. So mental health, counseling, psychiatry done in a primary care setting, for example, primary care coming over to where we do residential substance abuse treatment, for example.
Right.
So in my role, I'm really, really lucky enough to have a fantastic leadership team and a group of staff that are all in on this concept, but it really is an oversight of everything we do from a clinical delivery standpoint.
Yeah, which leads me sort of my next question, leadership. What's your approach to leadership? Do you have any kind of a philosophy that you can distill to several sentences, how you keep staff engaged, motivated, and at the top of their game?
When I knew that was going to be one of the questions, that was the one that kind of had me up at night, right? So how do you boil down my leadership philosophy? And there's some implication in there, I think, Charles, that I haven't figured
I
out.
first of all, had I known that I would have made any kind of contribution to your sleep deprivation, I would have apologized in advance.
That that's all right. You wouldn't be alone on the list of things that
Okay.
impact that.
All
So
right, small
so don't
solace,
take
but
it from.
solace nonetheless. Yes, okay.
But there's some implication that I haven't figured out, and I'm not sure I really do. I think that, and maybe at some level this is part of the philosophy, but I learn, I think, how to be a better leader almost every day, right? And that sounds a little cheeky, if you will, but if I'm if I think I have it locked down, then I'm probably not properly listening and responding to scenarios. So I think I do a good job from a leadership philosophy standpoint of being open, being available. I consider myself to be a kind of a cards face up on the table leader. There's, transparency, there's no secrets type of thing. I think I try to spin staff towards thinking about how we do something versus a why we can't do something. But I think I have weak areas too. And I think I do probably not as good as I could at staff recognition, which I think is an important part of leadership, but that's probably where I slip a little bit. So yeah, I think it's really about being present for the people around me at all levels.
Okay, good. No, I'm glad to know about that last piece because now I know exactly how hard I need to fish for compliments as we talk. You did also mention, we were talking earlier about your sense of awareness, which you implicitly are addressing, and clearly that's an important component, the awareness that you have things that you need to work on and the awareness as far as looking at problems and being creative in your solutions, being aware that you need to sometimes step out of your frame.
Yeah, I mean, I think that's a big deal. I mean, I think I'm not done, right? I mean, after 34 years here, I'm not done figuring out how to be in a leadership role. So
Yeah, yeah, that's what sort of, not all 33 years are created equally.
yeah.
It could be a real slog or it could be a real interesting process of learning about yourself, all those things. That's, what makes
Well,
33 years go by
yeah,
fast,
and I
actually.
think that's a great point, Charles, because I think that, you look across a trend line like that and you go, okay, gosh, how are we going to handle, changes on the federal front to Medicaid? Well, how are we going to handle COVID? How are we going to handle, et cetera? I mean, there's the cycle
Yeah,
goes through,
right,
and we've managed things as an agency before. So a
right.
level of, I think, optimism and can do becomes kind of core.
So I know you're a big football fan. So two themes sort of emerged to me immediately, just thinking from a football standpoint. 3 yards in a cloud of dust every day, get a little bit better. And the old expression, people talk about celebrating the end zone, act like you've been there before.
Yeah. Yeah.
And it's important, I think, to have been there before and, you seek a lot of strength or you find a lot of strength in that. You don't panic. You've been here before. This is a familiar situation. You figured it out before, you'll figure it out again.
Yeah. I would agree with that completely. Completely. I like
Matt,
to act like you've been there. I like that part.
yes, yes. Which is doesn't mean that I'm anti-end zone celebration. I go back to Billy White Shoes Johnson, that was always great stuff.
Sure. Well, I'm a Green Bay Packer fan, so come on, the Lambeau Leap.
Oh, there you go.
I mean, come on,
There you go. No,
share it with everybody, right?
that's exactly right, right? And you are, after all, a shareholder, right?
I have my single share.
You have your single share,
Yeah.
all created equally, sort of. Matt, I don't want you to play favorites, but off the top of your head, what would you say are the one or two programs that best exemplify Chestnut's innovative approaches and getting good outcomes?
Yeah, I'm going to go with two. And again, I appreciate
We
the
were
not
looking for
playing favorite.
five, but two is okay.
Okay. I appreciate the not playing favorites part. I think that from a truly embodying integrated care, when we began to shift patients seeking psychiatric services into the umbrella under the federally qualified health center side of our business, we saw much better kind of engagement in care. I think we see better clinical outcomes, and we allow then much easier for the patient to address both the behavioral health side of what they're experiencing, but also the medical side. So I think that conceptually doing that in a single environment was a huge win for us. Now I'm going to go opposite end of the spectrum. We have a very unique project that we've been working on for a couple of years in Missouri with the Metro Transit System, where we actually have
Yes.
staff
Yeah.
riding the
Great.
train, attempting to engage with individuals
Mm,
who present as impaired or homeless or what have you. And I think for me, that embodies what is historically Chestnut's kind of, we can figure this out. Show us a challenge. Let's get creative. Let's get down to grassroots care. Um, and do it from that perspective. So I love how those two
right.
examples, I don't want to say they represent the opposite end of the spectrum, but they are both strengths in their own way. One is efficiency of care, attending to all needs. The other is let's get down to grassroots outreach and meeting people where they're at. And so I think that that's kind of cool.
Yeah, no, that MetroLink program is amazing, and we've spoken about it and written about it, and that exactly is the uh, probably I wouldn't call it the signature program, but it's certainly something that I think really exemplifies all those qualities that you mentioned. That can-do spirit. Let's roll up our sleeves. Let's figure it out.
Well, and the other thing that's really unique about it, Charles, and this gets into we weren't going to go here necessarily in the conversation, but because of the way that program is set up and it actually being, really done in connection with the Metro Transit System and their security team and funded that way, it really represents one of the programs we have now where the business of healthcare doesn't get in the way of the provision of healthcare. It really is a straight line. Here's your money, come ride the train and help us engage people into care. And all of the other stuff that surrounds the provision of healthcare is lessened by that model, which I think is pretty cool.
Yeah, I have this question prepared, and you've sort of answered it in various ways during the course of this conversation, but I'm going to ask it anyway. In today's uncertain climate, what are the top two or three challenges, and what are you doing to overcome them? So, you spoke about some specific things. You started to talk about Medicaid. You also talk about general approaches and mindsets and finding solutions. So, what would you say to that? Top two or
Well,
three challenges?
yeah, Charles, I'm going to lump. Okay, so in isolation, right? Pending changes to Medicaid are going to be a challenge. In isolation, staffing and employee retention and employee recruitment it has been and continues to be a challenge. And I think three probably is particularly when you talk about community level healthcare, employee drift into private space, into, you know, online solutions where they can work from their kitchen table and things like that, puts a lot of challenge on the workforce side of the equation. But with all of that, overarching is really kind of just conceptually this idea of the unknown, right? We don't, we can say, oh my gosh, there's going to be an impact on Medicaid cuts, but we can't sit here today and say, is that impact going to feel like I got punched in the arm, or is it going to feel like I got punched in the face? And so, from a leadership challenge standpoint, um, trying not to get kind of sucked into the angst of the unknown, I think is the real trick. And I was at a conference last week and I heard a speaker use the phrase emotional contagion. So I did a little research. There's actually, this goes back to a 1993 study by a woman named Elaine Hatfield and her colleagues. And she said that we absorb the emotion of the people around us. So if I, as a leader, walk around the building going, oh my gosh, this is going to be the worst thing that's ever happened to Chestnut, I can expect my staff to start to
Right.
absorb that
It
emotional
catches,
reaction. So
right?
I think it's about walking around going, you know what? It's going to be tough. We'll figure it out. And our agency has a history of doing things really well that we can help combat what that change looks like. And so that to me, I think is part of what is going to have to carry us forward for now.
Yeah, well, I guess it's to some extent practicing what you preach, not entirely that. I mean, you talk about where you try to promote resilience and adaptability and so on and so forth. It would be nice if you as an organization did likewise, and obviously that's very much the case.
Yeah, yeah, I agree totally.
So I hesitate to pair this conversation with the one I just had with Dave, but my personal history with Chestnut and with both of you guys, it's impossible not to. And I actually asked him because when I started doing some consulting work, it was primarily for Chestnut Global Partners when you guys were launching this global model and doing all that work. So Dave and I talked about, those early days and what that was all about. So I'm kind of curious, given our history and given how that was initially how I came to Chestnut. And I know you've since sold off Chestnut Global Partners, but what if that work remains with you? What of that you apply on a daily basis to the work you do now?
Um, it's going to sound really subjective, Charles, but I'm going with it. The amount of energy.
By the way, you make me feel like I'm going to be throwing a flag on you or something like
Ah,
this.
no.
Mhm. All right.
The amount of energy and
Intentional obfuscation.
there we go. You're
10 yards.
you're skirting the
Loss of
question.
down.
You're doing a cheesy answer. It's not real. I think the amount of enthusiasm and energy it took to do that international work and try to adapt EAP services across the globe, it kind of just I think it kind of sets forward for me how I'm supposed to do this job, right? Like just because I'm not traveling to China or trying to figure out how to do EAP in Russia doesn't mean I shouldn't be energetic, enthusiastic, and trying to have a really good time all at the same time. So it's a very subjective answer because I'm not carrying forward like oh, I learned about the value of multi cultures or whatever. What I'm carrying forward, I think, is the need to sustain a level of energy through this, and that whole experience drove a holy cow, this job is fun. And I need to make sure that I have fun in the job as it sits today.
We talked earlier about leadership style, and you mentioned this term emotional contagion. That can also be contagious if you
Sure.
carry that spirit to work. This work is not just meaningful and challenging. Yes, it can also be tough, and you can have your failures and frustrations, but it carries the day when you go into it with a certain upbeat spirit as the overarching spirit.
So Charles, I got to ask you though. I mean, you did interview Dave, right? So Dave and I have worked for 33 years together. Did I parrot any answers? Because I don't want to sound exactly like him.
No, I think, you obviously have been colleagues. You've worked together. I know you've played together. I've been to several conferences with you guys, and it's interesting when you've worked together with somebody that length of time. I'm sure there's some things that are. So if there are probably some people objectively watching the two of you interact where there are certain qualities that have rubbed off on each of you, and you communicate in a certain way and all this. But yeah, I don't know. No, you have very different perspectives. You have very different experiences while working for the same company for over 3 decades, respectively. And I think you're both very enthusiastic about your work. He talked about going from camp counselor to CEO and one of the through lines in that journey is just taking great satisfaction in doing work that's meaningful, that has an impact. He talked about a couple of things that he considers signature achievements, having been associated with the development of the Workplace Outcomes Suite. We're talking about Chestnut Global Partners, that whole global model where you were obviously centrally involved. But no, I know you were asking it a little bit flippantly and also putting me on the spot a little bit, which I appreciate. But no, it's interesting, and it's just pure happenstance that I'm speaking to you after speaking to Dave, and obviously now he's moving into a different role with Lighthouse Institute and so forth. So it was an interesting sort of. It's hard to say, and I said to Dave at the end of the conversation, it's really hard to say. This is a summation. I can't pack 36 years into the space of a 30, 40-minute conversation. But anyway, I hope that was a satisfactory answer, Matt. If
No,
not,
that's good. It makes me feel better that you didn't have two podcasts in a row that sounded the same.
no, no. In fact, I think it's kind of interesting because to some extent, you're opposite different sides of the same coin, having been with the company for, again, over 3 decades. You've closely collaborated. You've traveled the world together, I know. Had quite a bunch of work-life experiences, but you two different humans and you look at things very differently. And most importantly, I don't think he is a Green Bay Packers fan.
I think you are correct. He is not. I'm not sure he has an NFL affiliation.
I don't know. That's a good
I
question.
I know in
That's a good
baseball
question.
he's a Royals guy.
He's a Royals guy. Okay. Anyway, Matt, this is really fun. I really appreciate it. I know we had a very, very specific window. You're a busy guy to speak, so I'm glad we're able to get this done. Thanks so much. It was a great conversation.
Hey, I appreciated it, Charles. It was nice to talk to you again.
Yes, that's same. Today I spoke with Matt Mollenhauer, Chief Clinical Officer at Chestnut Health Systems, where he's been for the past 33 years. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.